वेलकम बैक नाज़रीन और हेल्थ मैटर्स। हम बात कर रहे थे डॉक्टर हुसैन के साथ ऑन डायबिटीज़ और हम ये जान रहे थे कि जब हाई ब्लड शुगर होती है, लो ब्लड शुगर होती है तो उसके क्या सिम्टम्स हैं। आए हम जानें अब कि जब लो ब्लड शुगर होती है तो फिर क्या होता है। यस डॉक्टर,
Okay.
you were talking about hyperglycemia, which is
Glycemia,
high blood sugar. What happens when a person has low blood sugar?
Low blood sugar, actually I just mentioned also, the low blood sugar patient presents with headache, dizziness,
Yes.
palpitation, sweating, tremor, and confused, and then may have fall.
Yes.
So consequences, of course, having injury to the brain, maybe bleeding inside the brain or fracture. So we have to be very careful with hypoglycemia.
Yes.
If hyperglycemia we can treat little bit later, it's not a problem, but hyperglycemia, hypoglycemia we should have taken seriously.
Yeah. Dr. Hossain, tell us about when a person is overweight, how does diabetes affect the overweight patients?
Yeah, thank you for this. This is very important because most of the people now getting weight, gaining weight.
Yes.
And that is important for the diabetes because if you're gaining weight, there are a lot of insulin receptors in the body. It becomes resistant.
Yes.
So you have insulin in the body, but it does not work.
Yes.
So that's why we need to lose the weight. Then our insulin receptors can work properly, means their sensitivity is going higher.
Yes.
Then the insulin, that insulin in our body has already that can work.
Yes.
So for diabetes, we have to reduce the weight. And also, if you do exercise, reduce the body weight, your blood pressure also will go down,
Yes.
as well as your cholesterol also go down. So you
Yes.
prevent everything together if you do exercise and losing weight.
Yes. Dr. Hossain, I'm going to take you a little back. In the start, you said the symptoms for diabetic patients, they might feel thirsty. Can you explain our viewers a bit more on if they start feeling thirsty, if they start feeling this symptom first, should they take this serious?
Yes, that is important. Those who are feeling thirsty, they even didn't know. They think, especially in the village, in our community, in Bengali,
Yes.
Pakistani, and Indian community, they think, okay, I did work. I just walked in. I am working at home, feeling thirsty. Get 2-3 glasses of water.
Yes.
The daily basis they are doing, they are ignoring.
Yes.
No one wants to take that, okay, I'm having diabetes. No one wants to take that.
Yes.
And so that is very important. If you're feeling thirsty, think about diabetes. Why I'm feeling thirsty? Why I'm going to the bathroom more often?
Yes.
Why I'm waking up at night? Oh, I have to go. You know, in village, especially if you do pee, people pees in the street and the ants coming to get that urine because the sugar is there.
It's sweet. It gets
sweet
for them. Yes.
You know. So that is different actually. That is America is different. So we have to go to the doctors. We have to check routinely.
Yes.
Those who are going to the doctors routinely, at least they know what is the level of the sugar, what is my cholesterol, what is my urine, blood in the urine or sugar in the urine or urine is normal.
Yes.
We need to be careful and we need to go to the doctors annually, at least those who has no problem, no diabetes, no hypertension. So they have to go at least annually once.
At least once they should go and get it checked. Okay. Dr. Hossain, we were talking about overweight patients with diabetes. If they start working out, like start doing exercise, would their diabetes level will reduce or stay the same?
Yeah, again, this is very, very important for the diabetes and cholesterol and also for the high blood pressure.
Yes.
If you do exercise routinely, 30 minutes per day, 5 days a week minimum.
Yes.
That should be brisk exercise. Brisk exercise means you do exercise, you have to sweat. You have to burn something, then you have to see the reflect outside.
Yes.
So you have to brisk exercise and then you lose your weight, you reduce your cholesterol because you're burning.
Yes.
and your diabetes sugar level will go down.
Yes.
In that way, number one way, you can reduce the sugar level and you can prevent the diabetes.
So Dr. Hossain, was about overweight people with diabetes. What if a person is normal with his age and height? Does that person needs to have a workout as well, or no?
Yes, actually that is another important, because someone can say, I'm not obese, I'm not going to go to the doctor, I'm not going to see him because,
Yes.
I'm lean and thin. But diabetes also run in the family. We should know that.
Yes.
Sometimes people are very lean and thin and they have diabetes, they don't know. They said, I'm lean and thin, I have no symptoms yet.
Yes.
So they are not going. So sometimes those who are ignoring their presence to the hospital, they admitted to the hospital, ended up to the hospital with the symptoms, but that symptoms, serious symptoms.
Yes.
They change their mental status, their kidney already affected, their eyes already, affected, so they are not seeing properly and their heart is not functioning accurately.
Yes.
At that time they are going to the hospital. So that's why we need to prevent it. We have to go to the doctor, to see the doctor, and annually at least we have to visit to check the blood work.
जी डॉक्टर साहब ये बताएं कि प्री डायबिटिक क्या होता है?
Okay. There are three types actually: normal, pre-diabetes, and diabetes.
जी.
So normal, if your sugar level less than 100, and pre-diabetes is called borderline of diabetes, if your sugar level 100 to 125, that is fasting blood sugar.
Okay.
8 hours empty stomach, we go to the doctor, we check, and this is fasting, and this is 8 hours, 100 to 125. Then, if 8 hours fasting, it increases to more than 126 and above.
Yes.
It's called diabetes.
Okay.
And another way, we can check the hemoglobin A1C. If hemoglobin A1C is 6 to 6.5,
Yes.
it's pre-diabetes. It's called borderline diabetes. If more than 6.5, then it's diabetes. We start the treatment, but some patient wants to do exercise, diet control, then we give them SUNCH, like 3 months to see what's
Yes.
going on. So these are the types, basically pre-diabetes and diabetes. This way we can differentiate. Another way is postprandial, preprandial. It means after 2 hours after lunch, we can
Yes.
check. Also, if more than 200, then we can say that is also diabetes.
Okay. Doctor, you were talking about something called hemoglobin A1.
Yeah.
What exactly is that?
Okay, the hemoglobin A1C, this is another name is glycosylated hemoglobin.
Yes.
That is basically deposited in, that is basically a 3 months status, that last 3 months, how much was the sugar in our body. They can
Okay.
calculate and they can let us know this is the level. So suppose today you go to the doctor to check and you ate a lot of food. You said, I'm eating everything as
Yes.
much as I can, and you go to the doctor, that A1C would not affect it.
Okay.
Because that A1C gave you last 3 months status
Okay.
of diabetes, not today's status.
Okay.
So that's why sometimes people go to the doctor, they said, oh, I'm not going to check the blood today because I just ate it. You can check, you can see the A1C.
Yes.
If you have no time, something is better than nothing.
Yes.
If you have no time to go to the doctor, at least you can go and see. Even though if you eat food, we can see and we can tell is diabetes or not.
Yes. Dr. Hossain, ये बताएं कि insulin क्या है?
I'm sorry?
What is insulin?
Okay. This is a hormone basically. It secretes from the beta cells. There is a cell in our body, in the pancreas, that release.
Yes.
You can say when it is released. When you eat, the sugar level goes higher. When sugar level goes higher in our body, the signals coming from the brain, it's sent to the pancreas. Okay, go and release. So
Yes.
insulin coming from beta cells of the pancreas to push the glucose into the cell.
Yes.
So in that way, the sugar goes to the cell and give us energy, and we can do all the work.
So does a patient takes insulin as medication or it's as an injection?
Okay, basically, insulin, there are two types of diabetes I mentioned. Type 1, of course, insulin deficiency, you need insulin. Type 2, adult onset, and you need medications because you have insulin in your body,
Yes.
but the receptors does not work. That's why we are giving medication to increase the sensitivity of those receptors not working. But late stage, also that is not working well, and insulin production is not good enough. So we also give insulin even the type 2 diabetes in late stage if medication does not help.
Yes. Doctor, now it's time for a short break. नाज़रीन, हम जल्द हाजिर होंगे एक छोटे से ब्रेक के बाद और जानेंगे इंसुलिन के बारे में.